Hello, everyone. Welcome to today's webinar. We are going to talk about COVID-19 therapeutics, specifically the antivirals. My name is Chelsea Sprouse, and I am a pharmacist with the Virginia Department of Health. I do want to note that this information is the most relevant as of today, which is March the 22nd. So the first product we're going to dive into is Paxlovid. And Paxlovid is an oral antiviral used for the treatment of mild to moderate disease in adults and pediatric patients 12 years and older, weighing at least 40 kilograms. In order to receive Paxlovid, you do have to have a positive COVID-19 test result and also be at high risk for severe disease progression, which would include hospitalization or death. It is not for use in hospitalized patients with severe infection. So just for those who are at high risk for severe disease progression. For Paxlovid, it does come co-packaged with two ingredients, being nirmatrelvir and ritonavir. The normal dose is 300 milligrams of nirmatrelvir plus 100 milligrams of ritonavir, dosed by mouth twice a day for 5 days. It does need to be initiated preferably as soon as possible, but within 5 days of symptom onset. There is a dose adjustment for moderate renal impairment. So the dose of the nirmatrelvir gets cut in half. So for moderately renal impaired patients, it's 150 milligrams of nirmatrelvir plus 100 milligrams of ritonavir, still dosed twice a day and for 5 days. With that being said, if you are a provider or if you're sending in prescriptions for Paxlovid into any pharmacy, it is recommended that you specify the numeric dose of each active ingredient because your pharmacist or other healthcare providers might not necessarily know that the patient has any sort of renal impairment. So putting the exact numeric dose of the ingredients is definitely important to do. With that being said, these patients, when they go to the pharmacy, they're going to receive a blister pack where one of the tablets of the nirmatrelvir will be popped out of the package. So that's important just to make sure that you as a healthcare provider and then also the pharmacist just let the patient know that their blister pack was altered, and that was just to make sure that they receive the correct dose. For warnings and precautions, Paxlovid does come with a lot of drug interactions, specifically the CYP3A, which a lot of drugs use CYP3A. So if you are prescribing this for your patients, especially if they are taking a lot of medications, make sure you run a drug interaction checker before prescribing this medication. There is also a caution with pre-existing liver conditions, specifically because of the ritonavir component of the Paxlovid. With that being said, you also run the risk of developing resistance to HIV protease inhibitors if you have a patient with uncontrolled or undiagnosed HIV. For pregnancy and lactation, a lot of these products, since they are fairly new, there's not been a whole lot of studies done on these. The pregnancy and lactation piece, there really isn't a lot of data on that. And so that's pretty across the board for all of the therapeutic products. And here's just a picture of what the package is going to look like for Paxlovid. So if you look at the top, the package with the red circle, that's where you're just going to pop out one of the tablets and then put a sticker over where you popped out those tablets. So if you look at the lower right-hand corner, you'll see that there's this white sticker that was put over top, and that's just, again, to let the patient know that we took out that tablet just to make sure that they are receiving the correct dose in the case of renal impairment. The next product we're going to talk about is molnupiravir, which is also an oral antiviral. Also for the treatment of mild to moderate disease in adults only. So this product is for 18 years and older, not for pediatric use. Again, you have to have a positive COVID-19 test result and be at high risk for severe disease progression, including hospitalization and death. The dosing for molnupiravir is a little bit simpler. It's 800 milligrams twice a day for 5 days. No regards to food, so with or without food. It does need to be administered as soon as possible and within 5 days of symptom onset. There are not any expected effects on renal or hepatic impairment. And then for pregnancy and lactation, there actually is a black box warning for this product based on animal reproduction studies. So they did see, based on these studies, that it might cause fetal harm. So if you have a patient that's coming in, you definitely need to weigh the risks and benefits, especially since there are risks associated with untreated COVID-19 in pregnancy. So based off of other treatment options that are available, this might be sort of like a last line. So weighing your risks and benefits is definitely important. The reason why this product is not authorized for patients under the age of 18 is because it does have possible effects on bone and cartilage growth. Again, no data on lactation, but it is recommended to consider alternatives to breastfeeding. Next, we're going to talk about remdesivir, which is for the treatment of COVID-19 in adults and pediatrics with a positive test result, and for those who are at high risk for severe disease progression. The dosing for remdesivir does get a little bit complicated because you do have to take into account adult versus pediatric, and then you also have to take into account inpatient use versus outpatient use. So this slide here just shows the inpatient use dosing, and then the next slide we'll go over for the outpatient. The main things here to note is for adults and pediatrics 12 years and older, you're going to follow the dosing in the top box. If you have someone who is on mechanical ventilation or ECMO, they are going to have a longer duration of therapy, which is 10 days, versus if you have a patient with no mechanical ventilation or ECMO, the therapy is shorter, only for 5 days. Then if you look at the bottom, the important thing to note here is that for your pediatric patients less than 12 years of age, you do have to use weight-based dosing. Alrighty, and then for outpatient use, it is a little bit simpler here. So for adults and pediatric patients, the duration of therapy is only for 3 days. And this is because if you're using this outpatient, most likely your patient is going to have less of a severe case, so you can warrant a lesser duration of therapy. And then again, the bottom chart there shows for pediatric patients that it is weight-based dosing, and again, it is for 3 days for outpatient. For remdesivir, you do want to make sure you monitor your patient after injection and observe them for at least an hour after the infusion is complete. Remdesivir is not recommended if your patient has an eGFR of less than 30. Hepatic impairment has not been evaluated. And then also this one does have a lot of drug interactions. So if you have a patient that is taking a lot of medications, make sure that you run the drug interaction checker. And again, not a whole lot of data on pregnancy and lactation. And I put this slide in here just to kind of compare all of the products that we have available. So as you can see, the ones up top have the highest efficacy. So Paxlovid and sotrovimab and remdesivir. Molnupiravir has pretty low, only at 30% in risk reduction of hospitalization or death. Evusheld, which is for prophylaxis, does have a pretty high percentage in reducing the risk of developing COVID. For bebtelovimab, I do have question marks there just because they don't have exact data for the efficacy of this product. However, just for your information, they are saying that it's probably going to fall somewhere in between remdesivir and molnupiravir based off of what they know as far as efficacy. So not first line, but also not last line for bebtelovimab. Alrighty, and I put in here 2 email addresses that you all can use if you have any therapeutic specific questions. So whether that be you are interested in becoming a therapeutics provider, or if you have questions about therapy or anything else, the COVID-19 therapeutics box, you can email. And then if you have any general questions for COVID, such as treatment options, side effects, vaccines, anything COVID related, you can email the COVID pharmacy support team, and someone monitors those email boxes every day. So you should get a pretty quick response. And thank you all for listening today. Hopefully you found that important.